Heat warning. How hot weather increases your stroke risk. As summer temperatures reach record highs and the air becomes heavy and stifling, have you ever wondered, can extreme heat do more than just make you feel uncomfortable or exhausted? Could it actually raise your risk of developing a serious medical condition like a stroke? The answer is yes. And it's not some distant worry, it's a medically proven reality. Multiple studies have confirmed that summer heat waves can act as dangerous triggers for sudden, life-threatening strokes, especially in older adults or individuals with underlying conditions like heart disease or high blood pressure. In today's video, we're going to clearly and simply break down what a stroke is, what happens inside the brain when it occurs, and why hot weather can dramatically increase the risk. We'll explain the connection between dehydration, elevated blood pressure, electrolyte imbalances, and the body's impaired ability to regulate temperature, all of which can contribute to damage within the brain's circulatory system. You'll understand why scorching days aren't just hard on your skin or your energy, they're also a serious strain on your brain and cardiovascular health. Stay with us until the end of the video because the knowledge you're about to gain can do more than just help you stay comfortable this summer. It could save your life or the life of someone you love. Sometimes something as simple as drinking enough water, avoiding the sun during peak heat hours, or recognizing an early warning sign can be enough to prevent a devastating outcome. And every life-saving action starts with awareness. So stick with us, because the next few minutes may be the most important ones of your day. All right, let's start with the basics. There are two main types of stroke. First, there's an ischemic stroke. This is the more common type, and it happens when there's a blocked artery that dramatically reduces blood flow to the brain. Think of it like a plumbing blockage in a critical pipe.
Second, we have a hemorrhagic stroke. This occurs when an artery in the brain actually breaks, leading to a pool of blood that damages the surrounding brain tissue. Of these two, ischemic strokes are far more common. The amount of damage they cause is directly related to which parts of the brain are affected and, crucially, how long the brain suffers from that reduced blood flow. Now, you might have heard of a TIA, or transient ischemic attack. This is when stroke symptoms appear but then resolve on their own within 24 hours. While it's called transient and there are usually minimal long-term problems, a TIA is a major warning sign that a more significant stroke could happen. To truly understand stroke, we need a quick tour of basic brain anatomy. Our brain is incredibly complex, but let's highlight a few key regions. The most obvious is the cerebrum, which is divided into two cerebral hemispheres. Each hemisphere has an outer region called the cortex, and this cortex is further divided into four lobes: the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. Beyond the cerebrum, there are other vital structures. Below the cerebrum is the cerebellum, and connecting to the spinal cord is the brainstem. Interestingly, your right cerebrum controls muscles on the left side of your body, and vice versa. Let's look at what these lobes do. The frontal lobe is our control center for movement and what we call executive function, our ability to make decisions and plan. The parietal lobe processes sensory information. It helps us know where we are in three-dimensional space and guides our movements. The temporal lobe is key for hearing, smell, memory, and even visual recognition of faces and languages. And the occipital lobe is primarily responsible for our vision. The cerebellum, tucked underneath, is crucial for muscle coordination and balance. And the brainstem? It's absolutely vital, playing a role in functions like heart rate, blood pressure, breathing, gastrointestinal function, and even consciousness. Now, why is this anatomy lesson important when we're talking about stroke and hot weather? Because a stroke is fundamentally a problem of blood supply to these precise areas. Extreme heat can put significant stress on your cardiovascular system. Dehydration, for instance, can make your blood thicker and more prone to clotting. If you're exerting yourself in the heat, your blood pressure might fluctuate. These factors can exacerbate underlying conditions that lead to the blockages or ruptures we're discussing. So understanding the how and where of a stroke is critical. Let's talk about that blood supply. The brain receives its vital blood flow from the left and right internal carotid arteries and the left and right vertebral arteries. These vertebral arteries come together to form the basilar artery. The internal carotid arteries branch into the left and right middle cerebral arteries, which serve the lateral or side portions of the frontal, parietal, and temporal lobes. Each internal carotid artery also gives off branches called the anterior cerebral arteries. These serve the medial or middle portion of the frontal and parietal lobes and connect with each other via a short connecting blood vessel called the anterior communicating artery. Meanwhile, the vertebral arteries and the basilar artery give off branches to supply the cerebellum and the brainstem. The basilar artery then divides to become the right and left posterior cerebral arteries, which mainly serve the occipital lobe, some of the temporal lobe, and a structure called the thalamus. Finally, each internal carotid artery gives off a branch called the posterior communicating artery, which attaches to the posterior cerebral arteries on each side. Together, these main arteries and the communicating arteries form what's known as the circle of Willis. This is a critical ring-like structure at the base of the brain, where blood can circulate from one side to the other. Think of it as a natural bypass system. If one vessel is blocked, the circle of Willis can offer alternative routes for blood to get around the obstruction. In general, the brain can often manage with diminished blood flow, especially if it happens gradually. This allows time for collateral circulation to develop, where nearby vessels send out new branches to serve an area in need. But, and this is a big but, once the blood supply drops below what the tissue needs, tissue damage occurs, and that, as we've said, is an ischemic stroke. So how does an ischemic stroke actually happen? There are two main mechanisms. Mechanism number 1, endothelial cell dysfunction. The endothelium is the slippery inner lining of our arteries, called the tunica intima. When something irritates or inflames this lining, it's called endothelial cell dysfunction. A classic irritant is the toxins found in tobacco, which float in the blood and damage this lining. That damage then becomes a prime spot for atherosclerosis, the buildup of plaque. This plaque is a nasty mix of fat, cholesterol, proteins, calcium, and immune cells, and it starts to obstruct blood flow. This plaque has two parts, a soft, cheesy textured interior and a hard outer shell called the fibrous cap.
Branch points in arteries, particularly the internal carotid and middle cerebral arteries, are common spots for atherosclerosis. Usually, though, it takes years for this plaque to build up. This slow blockage only partially obstructs the arteries, so even though less blood gets to the brain tissue, some still flows. Strokes often happen when there's a sudden and complete or near-complete blockage. How? Since plaques sit in the lumen, or the inside space of the blood vessel, they're constantly stressed by the mechanical forces of blood flow. Interestingly, it's often the smaller plaques that are more dangerous. Their fibrous caps are softer than larger ones and are more prone to ripping off. Once that happens, the inner cheesy filling is exposed to the blood. This material is thrombogenic, meaning it tends to form clots very quickly. Platelets stick to this exposed material and release chemicals that enhance the clotting process. Within a minute, that artery can be fully blocked. Mechanism number 2, embolism. An embolic stroke typically happens when a blood clot breaks off from one location, travels through the bloodstream, and gets lodged in an artery downstream, usually an artery, arteriole, or capillary with a smaller diameter. These blood clots often emerge from atherosclerosis, but they can also form in the heart. For example, stagnant blood can form a clot, and blood can stagnate due to conditions like atrial fibrillation, an irregular heartbeat, or after a heart attack.
If a clot forms in the left atrium of the heart, it moves into the left ventricle, and from there it has a direct route to the brain. On the other hand, if a clot forms in the low-pressure veins or the right atrium, it goes into the right ventricle and usually gets lodged in the pulmonary capillaries in the lungs with no way of getting to the brain. An important exception here is if a person has a heart defect, like an atrial septal defect. This defect allows blood, and potentially a blood clot, to wander from the right side of the heart over to the left side. In that situation, a venous or right atrial blood clot can bypass the pulmonary circulation and establish a route to the brain.
Now, there are even specific types of ischemic stroke. One is called a lacunar stroke. These typically involve the deep branches of the middle cerebral artery that feed a part of the brain called the basal ganglia. Lacunar refers to lake because after a lacunar stroke, the damaged brain tissue develops fluid-filled pockets, or cysts, that look like little lakes under a microscope. Lacunar strokes classically develop as a result of hyaline arteriolosclerosis, which is when the arteriole wall gets filled with protein. This can happen due to hypertension, high blood pressure, or diabetes, and it can make the artery wall quite thick, reducing the size of the lumen. Another situation is when something like shock leads to a reduction in blood flow throughout the entire body. In these cases, the tissues that are the furthest downstream are affected the most. This is because healthy tissue continues to extract what it needs from the blood flowing by, leaving little or no oxygen and nutrients for the tissue furthest away. These furthest downstream tissues in the brain are often at the border of two different blood supplies. When blood flow throughout the body is diminished for any reason, these areas get damaged, and this pattern of injury is called a watershed infarct. Regardless of the specific mechanism of an ischemic stroke, it's helpful to remember that there's an ischemic core, the brain tissue that will likely die from ischemia, and then there's tissue around that core, called the ischemic penumbra. This penumbra is preserved for a period by collateral circulation and has a chance to survive if blood flow is restored quickly enough. This is why time is so critical in stroke treatment. What happens at a cellular level during an ischemic stroke? Without a steady supply of glucose and oxygen, cells run out of energy within minutes. This leads to a high buildup of sodium and calcium levels. High sodium levels draw water into the cell, making it swell. This is called cytotoxic edema. High calcium levels lead to the buildup of reactive oxygen radicals, which are damaging molecules that react with lipids, or fats, in the membranes of mitochondria, the cell's powerhouses, and lysosomes, the cell's recycling centers. Damage to these organelles allows apoptosis-inducing factors, which trigger programmed cell death, and degradative enzymes to seep out of the cell. Over a period of 4 to 6 hours, immune cells begin to haul away damaged cells. The resulting inflammation damages the blood-brain barrier, allowing fluid and proteins to get into the brain tissue, causing swelling, also known as vasogenic edema.
Because the skull creates a fixed volume, this swelling leads to a mass effect. The swollen brain tissue can push into the unaffected side of the brain, called cingulate or uncal herniation, or slip down and out of the base of the skull, called cerebellar tonsil herniation. This latter type is particularly dangerous because it can push onto the brainstem and affect breathing and consciousness. Stroke symptoms depend on the exact part of the brain that is affected. For example, an anterior or middle cerebral artery stroke can cause numbness and sudden muscle weakness. If a stroke affects Broca's area, usually in the left frontal lobe, it can cause slurred speech or difficulty forming words. If it affects Wernicke's area, usually in the left temporal lobe, it can cause difficulty understanding speech. If there's a posterior cerebral artery stroke, it can affect vision. A A simple acronym to remember some common stroke symptoms is FAST. F for facial drooping, A for arm weakness, S for speech difficulties, T for time. Time is obviously not a symptom, but it's a critical reminder to get help as quickly as possible to minimize cell injury and maximize the chance of a full recovery. So how is an ischemic stroke diagnosed and treated? To diagnose and confirm the location and size of an ischemic stroke, medical imaging with a CT scan or MRI can be used. Also, angiography, which uses contrast injected into the blood, can help visualize the exact location where blood flow is blocked within an artery. In addition, using flare sequence MRIs, it's possible to distinguish a new stroke injury from an old one. In an ischemic stroke, the ultimate treatment is to re-establish blood flow as quickly as possible to prevent further cell death, particularly in the penumbra. Every minute counts. So, thrombolytic enzymes like tissue plasmin activator or TPA are used to activate the body's natural clot-busting mechanisms. But TPA has a time limit for when it can be effectively used. Aspirin is also used to prevent platelets from forming additional clots. If TPA is unsuccessful, surgical procedures can be used. These can involve pushing a wire through the artery to physically remove the clot. In mechanical embolus removal in cerebral ischemia, or MRSI for short, the wire grabs onto the clot and draws it out of the artery. In section removal, the wire is used to physically break down the clot, and clot fragments are removed with suction.
After a stroke has occurred, there is an elevated risk of having additional strokes. So it's incredibly important to minimize risk factors. The main one is quitting smoking. Others include having healthy blood pressure, normal LDL cholesterol levels, and controlling other diseases like diabetes. Occasionally, a surgery may be necessary to help clean arteries obstructed by severe atherosclerosis. For example, in a carotid endarterectomy, the internal carotid artery is opened up and the atherosclerotic plaque is removed. Alternatively, a stent may be placed to keep the artery opened up. Okay, let's do a quick recap of what we've covered. An ischemic stroke occurs when there is an acute decrease in the arterial blood supply to the brain. This can be due to atherosclerosis, a thrombus, which is a clot that forms at the site, an embolus, which is a clot that travels from elsewhere, or a global reduction in blood flow. The goal is always to identify symptoms rapidly and re-establish blood flow to prevent long-term damage. And remember that common acronym, FAST: facial drooping, arm weakness, speech difficulties, and time. So as you can see, a stroke is a complex medical event with serious consequences. And while the mechanisms we've discussed are the underlying causes, periods of extreme heat can absolutely create conditions in your body, like dehydration and increased strain on your heart, that might make these events more likely, especially if you have pre-existing risk factors. That's why during these hot summer months, it's more important than ever to stay hydrated, avoid overexertion in the heat, and be aware of these stroke symptoms. Recognizing them quickly in yourself or someone else and getting immediate medical help is paramount. If you found this information helpful, please give this video a thumbs up and consider subscribing for more health insights. More importantly, share this video with your loved ones. Spreading awareness can save lives. Do you have any questions or perhaps your own experiences with staying safe in the heat? Please share them in the comments below. Stay cool, stay hydrated, and stay informed. Thanks for watching, and I'll see you in the next video.